Hi, and welcome back to Questions from Quarantine. I'm Tara Tyrell, and we're here with our research director, Dr. Margaret Bourdeaux, and Professor Juliette Kayyem at the Belfer Center at the Harvard Kennedy School. We're here, as always, to answer your questions, and the big question on everyone's mind this week is, of course, reopening. So we'll take this in two parts. Part number one, I'm going to throw this question to Margaret first. People are getting restless. I have personal friends who are very smart, very well educated, who have started taking trips, started going out to see family members because they've been in quarantine for 2 weeks and have shown no symptoms, and they now feel comfortable traveling. I know people are getting restless about work and lost income. So I guess I'd like to throw this to Margaret first, just from a medical perspective. You know, what are the risks of leaving the shelter in place, traveling particularly between states? And then Juliette, I'd like you to talk about this from a risk mitigation and a governance perspective. And then we will move on to part two, which is how we will open this country back up again. So Margaret, first, over to you.
Thank you so much, Tara. So everyone is restless.
Yeah.
I'm restless. My kids are restless. Everyone wants to go out and everyone wants to know when this is going to end. And the truth, though, is that what we are doing by staying inside and by socially distancing is that we are seeing really big payoffs in that strategy. We are flattening the curve. We are saving our health system. And I like to tell people and remind my own self, it's a little bit like a sunburn. You know, when you go outside and you expose yourself to the sun, you don't get the burn immediately. You get it after you go back inside. You notice that your skin is turning red. And that's the situation with isolation. You only see the payoff when you're doing it right. Okay, so and if we start to go out and about and give in to the desire to go and be with people and travel and interact and expose other people, we will then see a big reversal and progress, and we'll again see these explosions of cases, but it will be delayed, just like that sunburn is. So I just cannot emphasize enough how important it is to stay the course, to keep socially distancing as absolutely much as possible until, and there is something to look forward to. There is work to be done that will put us in a better position that is starting to happen, but I'll get back to that in a moment.
And Juliette, what's your perspective on this from a risk mitigation standpoint, particularly traveling between states with different rules?
Yeah, so it should not happen. And then just to pick up on what Margaret was saying, you know, I'm going to be really pissed if I've been inside for almost a month and then everyone else feels like they get to do whatever they want. This is a social contract at work here, which is we're staying inside to try to make sure that we don't continue the spread, but it has to run its course, and it hasn't run its course yet. And then this idea of opening up, the idea that the priority for opening up is going to be you getting to go to New York City, you, generic you, is ridiculous, right? I mean, we have priorities as a society, and the number one priority is to protect essential employees, not just in the health front lines, but now in the supply chain front lines, essential employees in manufacturing, other critical infrastructure that make America run on time or relatively on time. Those are going to be the priorities for safety and security. Your entertainment, whether you get to go to a movie or a bar or a restaurant, are sort of secondary and tertiary concerns. And I know that sounds incredibly harsh, but like this whole thing is harsh. I mean, that's the idea that there's an easy fix or an easy out or an easy solution. None of this comes easily, and we have to stop fighting it. And I do think that some of the messaging we get from leadership, like this idea that there's like a perfect treatment or a perfect vaccine or a perfect opening day, that is just not accurate. It's just not accurate. It's not an on-off switch. And so people just have to remain patient because it does work. That is in other words, the idea that it must not be that bad, therefore I go out, the exact opposite is true. It is very bad. Let's not doubt how many people are dying today. It is very bad. It would be, and that's with social distancing.
Yeah, so Juliette, if you don't mind expanding on, now we know, sort of not how it's going to go. It's not an on-off switch. It's not business as usual by June. Walk us through what sort of a good plan is, the gradual plan, both from sort of the higher levels, so the state and government levels, and then as that trickles down. And then Margaret, from a medical perspective, what can we expect to be happening? What's that timeline looking like? Is this 6 months? Is it 18 months? And, what are the stops along the way that we'll be making medically?
So I'm going to take a little bit of that question you gave to Margaret just to give a time frame. So we're here today, and then 18 months, like maybe if we're lucky with the vaccine, right? So we'll feel better if we say 18 months, but who knows, right? So because it has to be manufactured, distributed, and then the states have this complicated system called the points of distribution, the pod system. So it's not going to be tomorrow, but so what do you call this period? What is this period that we're heading towards? It's what I've been calling now, I sort of renamed the way I think about this, adaptive recovery. So recovery after a hurricane or earthquake, is, the crisis happens, the threat ends, and then you come in, you find the bodies, pick up the debris, and you start rebuilding. That's not happening here. I'm calling it adaptive recovery because the harm is still going to coincide with the trying to get back to whatever we're calling normal these days. So we're going to learn to live around, manage with, try to box in, you pick the word, dance with, everyone's using different words. We are going to coexist with the virus. Now, that sounds really horrifying. It's not, because the tools available, if we keep social distancing, if we give people time, are going to be much more diverse than what we have right now, which is essentially just staying home. Those are going to include, hopefully, better testing and tracing of the laws and requirements around quarantine, treatments that are coming online that I'm not a scientist, but I read it and that seems like really hopeful. There's going to be a shaming aspect to this. We tell our parents, no, you're not getting on a plane, or we tell our kids, no, you're not going to New York. And then there's going to be, and this is what we're not accounting for, a personal risk calculation. So I was thinking about this, like I'm a mother of three, a breadwinner with my husband, 3 healthy kids. I'm healthy. I plan on living a long time. This will be a weird 2 years of that long time, or however long. But so I want to go grab drinks with girlfriends. I don't know the bar we're going to. I don't know how many people are going to be there. I don't know the other people are going to be there. Like my risk calculation, yes, they're going to take temperature, but maybe not. All of a sudden, my risk calculation also factors in, and I'm not going to do that, right? So our primary focus has to be the people who don't have choice. I mean, in other words, people who work in industries that they have to work, manufacturing, supply chain, all that stuff I talked, to get them back and safe, right? So that the rest of society can run. That's how I think about people the next 2 years. Like everyone has to get it through their head, but I'm not negative about it. We're going to be better off about it.
Excellent. Yeah, so to kind of dovetail with that, the thing that I think is, so right now we're still in the wave, right? We don't really know how high that wave is going to be. We're in the wave. We're in the first wave where we're seeing the uptick in patients. It's climbing every day. We don't have our arms around who has it, where it's gone, where it's spreading, who has been exposed, and so we're going to see this uptick in cases. We're all just, sticking tight to the social distancing. And then that wave is going to crest. It's going to start to come down. And so, sorry. So then, when on the other side,
happening in the middle.
Someone, that's so funny because someone just came to my door and I was like, five, give me 5.
Exactly. Someone's bouncing around. So once we come down that wave, hopefully what we're going to work very, very hard to stand up is community-supported surveillance. So what that means is that we are going to have enough testing in place We're going to have contact tracing capabilities to know better who has been exposed to the virus. And we're going to have a package of programs in place to support people who have been exposed to stay in quarantine for 14 days. So those and to help people who are sick stay isolated and keep them from infecting others. So those programs, that's the work that has to happen right now. And people, when people say to me, when is this going to be over? I keep saying it's going to be over when that work has been done. Okay, when those programs and capabilities have been created and stood up, then we're going to have an opportunity to open up more broadly. It is going to be staged. It is going to be weird. I would say the biggest idea that people are going to have to wrap their head around is that they might get a phone call from a contact tracer saying, you've been exposed and you need to go into quarantine for 14 days. And they're going to have to be like, play ball with that and go and be in quarantine for 14 days. And on one hand, speaking of the social contract, which I love, that idea of, on one hand, we need to do our part to make sure that people can do that. They can be in quarantine for 14 days. They have the support that they need to make that doable. And on the other hand, people are going to have to do it, and do it for real, because that is the one thing that we will have. That will be basically the only thing we have to actually contain this until we get this vaccine and are able to distribute it.
So now, as we're thinking about this, in a truly long haul kind of sense, but life goes on, as we move into our sanity and sanitation segment, what are your tips on sanity in particular, but also sanitation for the long term? For example, I last week cut my own hair in the yard with the help of my husband and YouTube, and it went about a B-. And I'm
think
sure
it looks good.
I know.
Good.
This is a lot.
The weather is horrible right now. So for sanity, I got ear pods. It was an expensive investment, and I walk everywhere during my calls. I must be doing an extra 4 or 5 miles. So I exercise every day. That's just something, but I've always done that. So it's not like it's unique, but if I had dropped it, I would have felt not normal. And then now we're instituting a little bit more regimen on family time, because my kids are a little bit older. And so literally we could be in 5 different rooms for all day. So yesterday we went for a hike. We found a place where there was no one, and then we saw a movie, and it felt like as normal as we could. But, I kind of gave up on normal. I'm just sort of like what feels good and not good at any given moment.
Yeah. I mean, I think this is, on one hand, I think there are things that I've really been enjoying, about being home and having more time with my family. I know that is not true for everybody in this situation, for sure. But, I would say really trying to live in that moment and really enjoying the things that you actually have access to. This is a huge excuse to do some things that to spend time together. And so really enjoying those little sweet moments. We had a fun thing we did, which is the kids wanted to have a drive-in movie theater night. And so we put the laptop downstairs, and the kids made their own cardboard box of cars and dressed up like, it was super cute. They dressed up like 1950s characters, and we watched Grease, which was like really fun and cute. And I was like, you know what? We never would get to do things like that if everybody is busy at school and running out to hockey and whatever. Trying to enjoy that. And I think that whatever those rituals are that give you some sanity, just doing it at the same time every day, that little ritual, whatever it is, is important. And I also think like now is a great time to really lean into building that social network that we're going to need for the long haul. Who are the people that can help you get groceries? Who are the people that you can help? Who are the people that you can anticipate some needs for? It's a good investment.
Well, on that,
I think can I just add, I was making fun of those Zoom drinks things when I first heard of them. I do it for like 30 minutes. Like, you don't have to like do the whole evening. You just like touch base with a girlfriend for 30 minutes because you're not seeing people. Like, that's the thing. And I was doing it with like all these people out of state. And then I realized my closest network here, I was not seeing because we're so used to not doing that because we see each other at coffee or drink or whatever. So I'm all for that now. I'm drunk now. No, I'm joking.
Well, the downside is if you don't want to do it, you have no excuses, right? If you don't want to meet your friends for drinks in person, you have a million excuses. But if you
that's true too.
you have no excuses.
Well, the one thing I will say, sorry to go on, but the one thing I will say is you do need to put a limit on them because no one has an excuse to do anything. Yeah. So you're just all sort of lingering. And then someone finally says, okay, we're calling it a night. I was like, okay.
Yeah. Well, speaking of lingering, we're going to wrap this one up. Thank you so much for joining us.
Thanks, you guys.
Please feel free to
#questions from quarantine
for next week, and we will see you next time. Thank you.